Over in Triage, 58-year-old electrician Roger has arrived with paramedics after falling through a ceiling manhole.
So he's fallen through the roof onto the ground?
Yep. Looks like the ladder slipped out from underneath him.
Nurse Lucy Stranger is assessing patients this evening, and her job is to find out if Roger needs immediate attention.
Hello, can you open your eyes for me, matey? I'm over here. I need to check his level of consciousness. And if that's at the highest level, which is at 15, that's brilliant, totally orientated. But if it sort of drops off, it can be that there's something going on internally. Roger. Roger?
The tradie is showing worrying symptoms and is being taken straight to trauma, where Dr. George is standing by.
Roger, I'm George, one of the emergency doctors here. Clearly, you look like you're not feeling too crash hot today.
Where's that pain, mate?
Roger's a 58-year-old Sparky. He had an unwitness fall. He's got a graze on the inside of his right bicep, which is consistent with having his arms above his head. He's got a sore left shoulder, sore left hip, which is not complaining of any headache or cervical neck pain. It's always been lumbar pain.
Excellent, thank you very much. Fall off a roof from several metres up, you impact usually on concrete with absolutely no, safety device to prevent injury. The kinds of injuries I'd be typically expecting is chest, usually some broken ribs, some lung contusions, maybe some spinal injuries, maybe a pelvis fracture, and maybe he's got a limb or two that's broken. Can we get in some oxygen, thanks? Yeah.
Best mate John was with Roger when he fell.
We're at my son's house, just trying to finish off so they can shift in. And he's had to go up in the roof and put his bladder up in the manhole. And I think as he was walking up, it slipped out and he's obviously fallen down and done a bit of damage to himself. Yeah, a bit of a shock.
Can you feel me touching your feet? Yeah. Any numbness or tingling? Nah.
Roger can feel his legs, but it doesn't rule out spinal injuries.
Yes, if there's pain, no, if no pain.
So we're going to try and get some x-rays. So if anybody's not wearing lead, can we start migrating out of the room? Thank you. So his x-rays actually weren't too terrible. Looked like he might have some left-sided chest injuries, but you don't get a lot of detail in your simple x-rays, so...
John will be here for when you get back from your scans, OK?
And while Roger seems more alert, he could still be seriously injured.
What we're going to do now are some CT scans all the way from the top of your head all the way down to the bottom of your pelvis. One of the things that's the most disturbing for all emergency practitioners are chalk and dye patients. The idea that somebody seems to be well and then deteriorates. They're a rare population, but they really stick in your mind. And, if you've ever seen a situation like that, you become very vigilant about making sure, yep, this is probably just the same as all the other trauma patients, he'll be just fine. But I need to make sure we're not missing any life-threatening injuries.
Dr. George Plunkett's patient, electrician Roger, fell through a ceiling manhole, landing on concrete.
He's going to have broken something, probably a few things. So we will do a CT because he's landed on his head and his abdomen and his pelvis because that's where most of his pain is. And at the end of that, we'll have a hell of a lot more idea of exactly what his injuries are. And then we'll be able to come up with a plan of how we make him better.
Okay, starting cold injection now, nice and still.
Please breathe in and hold your breath. Pelvic fracture, let's see. Any pelvic fractures? This looks alright. Looks pretty good. Yeah. No pelvic fluid, which is always a good start.
Roger's pelvis looks okay, but injuries to his back are severe. There may be bone fragments which could sever the spinal cord and lead to paralysis.
So, Roger.
Yes.
I thought I was for sure going to see some pelvic fractures, but I couldn't see any, so that's really good.
That's fantastic.
We're not yet out of the woods, though. Our radiologists will go through it with a fine-tooth comb. So we'll know over the next couple of hours that we're not missing anything.
Roger's future as a self-employed electrician could be at risk.
Yeah, Roger.
You're not bad, John. Appreciate you coming in.
Roger was helping his mate John do some work on his son's house when the accident happened.
Sorry I fell.
Oh, Jesus. Just as long as you're on the car and goes away.
He's a good man, a good friend.
That's what I'm looking for.
58-year-old Roger is still in severe pain after falling through a manhole. He's waiting to find out from Dr. George how badly damaged his back is and whether he'll walk again.
Now, so Roger,
Yes.
the radiologists have had a chance to have a look with a bit more detail, and they've spotted that you've managed to break a couple of bones in your back. So one of those is a bit higher up, kind of about the level of your shoulder blades. And that one, to my eyes, as a non-spinal expert, looks like it will heal up fine. There's one a bit lower down. That one does look like it'll need surgery to stop the free bits of bone wiggling around it. We're letting the orthopaedic spinal surgeons know about you to help come up with a plan for you.
Okay, thank you.
Okay? Roger's got what's called a burst fracture of his vertebra, so the main part of his vertebra has essentially exploded. And that's, you know, what we would call an unstable spinal injury. So that means that bony fragments can shift around and are unlikely to heal, you know, rapidly and well without needing some surgery.
For Roger, his worst fears have come true.
It's a day-to-day reminder that life's fragile and, you know, somebody can be perfectly well in the morning and not a couple of minutes later. It makes you appreciate what you've got and to make the most of what you have.
Dr. George's patient, Roger, survived his 2.5-metre fall from a manhole. The self-employed electrician broke his back and needed spinal fusion surgery to repair the damage. Roger was released from hospital a week later, but sadly hasn't been able to return to work.